So over the last years, we mainly studied patient cohorts that were derived from clinical trials. And most of the clinical trials were done in younger AML patients that can be intensively treated. But with many cancers, AML is a disease where the incidence increases with age. Now the median age at diagnosis is around 70 in AML. So that means over half of the patients that have an AML were not reflected in these studies because these studies were all done in 60-year or younger patients. And we have shown, and others as well, that the genomic spectrum of the disease is completely different in older patients. And this might also explain why we do so poorly in our older patients with conventional chemotherapies. It's important to see the entire patient. So you have to see how fit is he, how biologically fit, what can he bear with regard to the intensiveness of the chemotherapy, does he have any other health conditions. But on the other hand, it's also important to understand the biology of the disease better in these patients, because what we now know that many of the older patients have mutations where we already know that they will not respond, for example, to classical chemotherapy, and then we now really have to embark on novel treatment strategies, innovative treatment concepts for these patients with, let's say, new drugs like epigenetic drugs or immunomodulatory approaches.